Changes to the Patient Protection and Affordable Care Act, ACA. The impact on healthcare quality, access, and costs. This presentation will be given by Madison Dennis, Elizabeth Mulder-Stopacki, Tracy Sullivan, and Devin Wiley. Since the 2016 presidential election, there have been multiple changes to the Patient Protection and Affordable Care Act, ACA. This group presentation explores what those changes are and how they've impacted healthcare quality, access, and costs.
The ACA has helped millions of Americans gain coverage, save thousands of lives, and strengthen the healthcare system as a whole. This has specifically impacted the lives of those in which have lower incomes, pre-existing conditions, or even those who were previously uninsured. Furthermore, the ACA has helped those with underlying conditions or pre-existing conditions by providing them with protection so that they can no longer be discriminated against. Another change made has allowed for women to no longer be charged more than men for health insurance. Also, medicine for young adults and children is now more affordable because of the ACA. This also covers young adults and children at a higher rate. All Americans are able to have an increased access to prescription drugs due to this new law. The ACA has helped over 20 million Americans gain coverage to their health insurance. In general, all Americans are able to have access to affordable health care. Medicaid has expanded across the states and has allowed for more Americans today to have access to their health care. Also, Medicare out-of-pocket rates were previously high before this took place. However, the ACA has now allowed older adults to pay lower out-of-pocket fees. A new record released by the HHS reports that 31 million Americans have health coverage through the ACA. This is a new record for the highest number of Americans covered by the ACA. When taking a look at the rates on a state level, it is evident to see that reductions in the amount of uninsured individuals were being made. Today, there are many Americans that are already enrolled in the basic health program that has gone through the ACA. Moreover, in regards to Medicaid, there are previously 4 million eligible adults that were enrolled for coverage. By the time expansions were being made, these individuals were able to receive an increase in federal funding. Those who are under Medicaid have also reached a record high due to the expansion. According to the Commonwealth Fund, in combination with insurance market reforms, exchanges are intended to make the markets for individual and small group insurances easier to navigate by enabling side-by-side comparisons of health plan benefits and costs. They are also intended to encourage competition among health plans and thus make coverage more affordable. To promote transparency, competition, even efficiency, federal reform requires that the exchanges take on certain functions such as certifying whether health plans are qualified to participate and coordinating with appropriate state and federal agencies.
The United States invests more into the healthcare industry than any other country. However, they remain one of the few without a universal healthcare system. As a result of the government's investments and other legislative factors, the system has become inefficient in providing individuals with quality and accessible care. Additionally, the government spending has caused healthcare prices to increase, making them unaffordable to most. In 2010, the Affordable Care Act, previously referred to as the Patient Protection Act, was passed. The overall objective of this act was to reform the U.S. healthcare delivery system. As a turning point in health policy, the Affordable Care Act aimed to enhance patient accessibility to healthcare services through 5 goals. The 5 goals provided in the Affordable Care Act include 1. Increase insurance coverage through the collaboration of government agencies, employers, and patients. 2. Improve equity, quality, and affordability of health insurance coverage. 3. Enhance the efficiency and reduce costs of health delivery by reducing medical errors and wasteful spending. 4. increase healthcare access and patient engagement through promotion of primary and preventive health services. And 5, redistribute investments towards areas that benefit the public, for example, community health programs. These goals of the Affordable Care Act all have a common underlying theme: increasing access to affordable health insurance coverage and services. Previously established government programs were expanded upon in the Affordable Care Act, specifically Medicaid. Medicaid, a federal and state-funded program, was originally established as a financial assistance program for low-income individuals. To be eligible for Medicaid, an individual would have to meet specific financial criteria. Prior to the passing of the Affordable Care Act, the criteria for Medicaid eligibility were: 1. Families and dependents enrolled in community assistance programs, 2. Individuals collecting Social Security income, and 3. Individuals with an income lower than 133% of the federal poverty level. In short, an individual's Medicaid eligibility was based on their financial assets. To increase coverage and accessibility, the Affordable Care Act established provisions which expanded upon these Medicaid eligibility requirements. The Medicaid expansion lifted prior regulations that had hindered people's ability to obtain health insurance. The Affordable Care Act called for the expansion of Medicaid eligibility up to 138% of the federal poverty level in all states. Additionally, individuals under the age of 64 with no dependents were now eligible for coverage. Prior to the passing of the Affordable Care Act in 2010, approximately 46.5 million people were uninsured. By expanding Medicaid eligibility, the number of uninsured has since decreased by 31 million. The government's promise of increased coverage would not be possible without making provisions to the insurance market as well. The expansion of Medicaid required the Affordable Care Act to include other mandates, specifically provisions to health insurance premiums. The expansion of Medicaid and the private insurance market caused insurers to increase coverage to low-income individuals at an affordable price. To offset the increased costs, insurance premiums would increase for other individuals not covered under the expansion. When first implemented, these expansion caused a subtle increase in health insurance premiums. In 2018, the lowest insurance premiums had increased by 29%. Insurance organizations increased these premiums to ensure that they could adequately cover the amount of new and current consumers. Since then, insurance premiums have gradually decreased. In 2020, the cost of insurance premiums decreased by 3.5%. Now that insurance organizations have adjusted to the Affordable Care Act mandates, premium prices have declined. Even though aspects of the healthcare industry have benefited from the passing of the Affordable Care Act, there are opposing parties who want to repeal these mandates.
Attitudes towards the ACA. There have been many claims on both sides about the ACA's accomplishments and shortcomings. These differences in perspective are often the center of political debates. You have your proponents and you have your opponents. Proponents are those who acknowledge the passing of Obamacare as a landmark legislation in the U.S. healthcare system that has lowered costs, protected patients, and increased affordability. According to Congressional Budget Office, it's been estimated that about $210 billion will be reduced from the nation's budget. Opponents are those who believe that ACA is unconstitutional and that healthcare costs will rise, quality of care will be reduced, and a new entitlement will be established. It has been estimated that over the next decade, the enactment of this law will increase the nation's deficit by $340 to $700 billion. In simple terms, proponents are those who are for the ACA, and opponents are those who are against it. There is still a huge debate on provisions of the ACA, but most think that it's wise to keep them in place. The reason being is that provisions prevent insurance companies from denying coverage to those who may have pre-existing conditions. This is also known as guaranteed issue. These provisions also keep insurance companies from charging people more for coverage based on their medical history. According to a July 2019 KFF health tracking poll, 72% of the public expressed the importance for provisions to remain intact, where there was a 64% community rating. It seems that most Democrats, Republicans, and independents agree that pre-existing conditions must stay. However, there's still a divide and many challenges facing national policymakers.
Challenges facing national policymakers. Policymakers have had and continue to have long battles ahead of them regarding the Affordable Care Act. Deciding if the ACA is worthwhile, fighting between political parties for what is best for the public, disagreements over affordability, taxing, extending coverage to the entire population, have all occurred and continued to drag on over the years. Legal battles and lawsuits over mandated care requirements are also challenges facing national policymakers. Since its inception, there have been numerous changes and challenges with implementing the ACA. Between 2010 and 2016, House Republicans passed repeal bills more than 50 times. Although the votes felt largely symbolic, given the GOP did not control the Senate until 2015 and did not control the White House until 2017, those votes were part of a broader campaign to undermine the law. Challenges facing state policymakers. There are several challenges that also face state policymakers regarding the Affordable Care Act, including offering care that remains of high quality and being cost-effective while still enabling organizations to gain revenue in order to keep both companies and the community satisfied. Convincing the community to enroll in the healthcare plan and educating them on the benefits of health insurance, the importance of proper healthcare maintenance, how to enroll in the Affordable Care Act, where and when to receive services, and keeping those who enrolled long-term are also challenges that state policymakers face. Why the Affordable Care Act has been a good law. It has reduced the rate of uninsured individuals, have increased the number of people with health insurance, brought health insurance and more affordable health care coverage to numerous members of the population who had minimal or zero care. It has also improved the health of the population and grown healthier communities by affording access to healthcare treatments and medications, reducing the need for more extensive treatments by following proper maintenance, in turn decreasing chronic diseases and illness by increasing their maintenance. It has also granted policymakers the ability to offer and expand Medicare to their state for those who are in need. It has also brought renewed respect to policymakers who community feels that they are being heard and cared for. Why has the Affordable Care Act been a bad law? Although the ACA has been highly beneficial to many members of society, there are still some negative aspects to the law for some people. Negative impacts of the ACA including increased costs for those who do not qualify for coverage, such as receiving tax penalties for not holding coverage and higher premium rates for some. Some employees have also found that their employers have reduced or eliminated employee-sponsored health plans to be more cost-efficient. This in turn has also caused employee rates to increase by shopping for their own coverage, which is also stressful and can be complicated. There's a limited number of enrollment periods, difficulty with the website, and more coverage options to choose from. They also find that there's a number of shrinking networks of insurance providers, that more of them are not in network than they were previously, resulting in higher costs and fees. Future considerations for policymakers. If the court were to wipe away Obamacare, it could have a sweeping impact on the nation's healthcare system. It can cause a detrimental loss of health, increased diabetes, heart attack, cancer rates, and higher losses of life. Not only for the roughly 20 million people who've gained coverage through the Affordable Care Act and through the expansion of Medicaid to low-income adults, but this law also allows parents to keep their children on their health insurance plans until the age of 26, obtain free mammograms, cholesterol checks, and birth control. The availability of health insurance actually increases the use of healthcare services and can thus increase revenue for the state, either from the government-run health services or taxes on private providers. It can help build a stronger economy by creating more job opportunities and increasing the workforce with a healthier population, reducing poverty in rural areas. Additional alternative health insurance affordability options can also be considered, such as increasing reduced rate fees for service, putting capping limits on insurance companies and pharmaceutical companies.